Everyone, I'm Zach Kuntz. I'm the Planning Section Chief for the COVID-19 County Incident Period Briefing for Ops 3, which is 3/27 through 4/3. Our overall goal is here listed on the screen, which is to reduce the spread of COVID-19 in Haywood County. We have management objectives that have been given to us by our policy group. Those objectives are listed there before you. We have a policy group that we will be utilizing. We are charged with engaging all disciplines. We've been told this is a marathon and that health and wellness is a priority, and we want to emphasize that to everyone. Situation reports from our team are due Monday, Wednesday, and Friday every week. Like mentioned before, we have a policy group. That group is here listed on the board in front of you. That is composed of the Emergency Services Director, the Sheriff, the Health Director, all 4 towns, the County Manager, and elected officials. Under our policy group, you will see the org chart before you, which is our command and general staff. Travis Donaldson is our team lead. Our safety officer is Jory Miller. Our liaison officer is Wayne Morgan. We have a PIO who is Lindsay Regner, an assistant PIO who is Allison Richmond. Our operations section chief is Cody Parton. I'm your planning section chief. Logistics section chief is Travis Donaldson, and our finance section chief is Julie Davis. I'm going to now turn it over to Ops.
Good morning, everyone. Cody Parton, Operations Section Chief. I'm going to first start off here with some current operations, but I'd first like to state our statement. We, as the incident management team, are to help coordinate a unified response to COVID-19 and provide support to everyone involved, primarily in Haywood County, but also throughout the region. We will accomplish this through preparedness, incident management, and quality medical care. We're maintaining a comprehensive organizational structure built of multiple organization disciplines. We have formulated multiple contingency plans based on the objectives given to us. We continue to have good, effective communications with all units in the operations section. Situation reports are being issued on Monday, Wednesday, and Friday evenings to the policy group. We continue to do research along with medical experts on obtaining pertinent and crucial information for public releases related to COVID-19. I remind you again, please reserve 911 for emergency use only. Please use the local Haywood County information line established for Health and Human Services questions related to COVID-19 at 828-356-2019. We continue to strengthen working relationships with all partners involved using a one team, one voice approach. We continue to reach out throughout the western region of North Carolina to obtain information and see what is and isn't working in our surrounding counties for the betterment of Haywood County. Next, I'll go to control objectives. Our control objectives, the first one is establish a plan and be prepared to operate an isolation quarantine site as soon as possible. We have a social isolation task force that is diligently working to provide us with the facilities to accommodate this. The next objective is to maintain support and ensure safe operations of essential local government functions. We will continue good communication through our continuance of operations group to monitor improvements and changes in functions in the county and all 4 of our municipalities. The next control objective is to deliver appropriate, clear, relevant, and action-based communications / instructions to public and private partners and the community. We're working through our public information officers to provide the most up-to-date information from all local, state, and federal resources to provide the appropriate, clear, and relevant information. The next objective is to monitor and report economic impacts daily. We will continue to monitor the economic impacts on a daily basis through our Economic Impact Task Force that is gathering this information and reporting it back. The next control objective is to identify and implement measures to care for the basic needs of impacted communities and citizens, especially vulnerable populations affected by our requirements. We have and continue to develop and modify contingency plans to address these basic needs for our communities and citizens. The next objective is to activate and operate the team's alternative processes and facilities for triage, testing, and screening upon approval. Working through our field response task force and testing task force to provide the most up-to-date procedures for plans to address the alternative processes for facilities, triage, testing, and screening. Work with partners to create contingency plans to address any plausible local situations not already completed. Examples include but not limited to supplemental law, fire, economic impact, mass fatalities, and health and wellness plans. Multiple contingency plans have already been formulated and are continuing to be created and modified as needed to address these and many other plausible local situations that may arise. Next, I'll go to the organizational chart. I have a Deputy Operations Section Chief, Bill Miller. Bill, if you will, please stand. Next up, I have my Health and Human Services Branch Director, Ira Dove. Mr. Dove. Under that branch director, I have two groups, the Human Services Group and the Public Health Group. Under the Human Services Group, I have Nutritional Coordination Task Force, a Public Health Education Task Force, School System Task Force, and Adult and Child Protective Services Task Force. Also under the Health and Human Services branch is the Public Health Group. This includes Field Response Task Force, the Testing Task Force, and the Haywood Regional Medical Center, our local hospital. The next group I'd like to highlight would be the Continuance of Operations Group, which is led by Crystal Patterson. Ms. Patterson. Moving on to the next group was the Law Enforcement Group, which is led by the Group Supervisor, Don Robertson. The next group is the Fire and Medical Group, which is led by the Group Supervisor, Darrell Henderson. And then last but not least is our Community Support Group, which is led by Michael Street, who is unfortunately able to be here this morning. In this organization chart you see before you, these and other outstanding individuals are the makeup of the team to form the groups and task force, and have done a great job and continue to do so. And I thank you for your support.
Good morning, Jory Miller, Safety Officer. I'll be responsible for the medical plan and the safety message. Under the medical plan, the County Wellness Clinic continues to request employees to call before coming and would also like to share that they do not have the ability currently to test for the COVID-19 virus. Under the safety message, in order to continue to provide for the safety of the citizens, public, and first responders of Haywood County, and to maintain, support, and ensure safe operations of essential local government functions, we must keep up with key changes to guidelines and safety recommendations made by the CDC. In my safety message, I have listed these recommendations for first responders as well as law enforcement. Also included are strategies for extending the use life of respiratory protection. Social distancing, as well as hand washing and use of hand sanitizer, remain the gold standard of prevention. As this incident continues, mental wellness is also paramount. I have given basic mental wellness tips as provided by the CDC, as well as County Employee Assistance Network contact information. Thank you.
Good afternoon, everyone. I'm Travis Donaldson. I'm your Logistics Section Chief. We're coordinating all county logistical needs within the IMT. Please submit any resource requests through your group soups and section chiefs, who will then submit it to the logistics section. Please track all expenses through our finance section Deputy Chief, Ed Saline. Track all mileage on vehicles on your 214s. Please be sure to keep track of your 214s. These will be crucial for any kind of reimbursement.
Hi, everyone. My name is Lindsay Regner, and I'm the Public Information Officer for the Haywood County Sheriff's Office. I'm also filling in as the County PIO right now. And I just want to focus on the main resources that we have in the county for people to receive the most up-to-date Haywood-specific COVID-19 information. So the top one would be haywoodcountync.gov. That's the county website. If you go under the coronavirus info tab, you'll see a long list of stories that have been posted over the past couple weeks. We keep that portion of the website updated several times a day. And again, it's all Haywood-specific information. So we really encourage people to check out that website. We're trying to make it as helpful as possible. And one document that was updated to this tab yesterday that we really want to encourage people to check out was created by the county attorney Frank Queen. It's essentially an interpretation, explanation of the stay home proclamation, and it also answers frequently asked questions. It's a very helpful document. We promoted it through traditional media and on social media yesterday. So again, we're getting a lot of these questions from the citizens, a lot of the questions that are answered on this document. So please look at that. Again, that's under the coronavirus info tab. We are experiencing a little bit of a glitch, not with the website, but with how the website transitions to social media channels. And it seems like this is an issue with Android cell phone users. So if I were to share one of the stories from our county website to Facebook, and an Android phone user were to click on that link on that Facebook post, they sometimes get a broken link. So we're encouraging people, if they have that issue, just manually go to your browser and type in haywoodcountync.gov, and you can get to the website that way. Again, if you're experiencing a broken link through social media. So some other resources we have our Facebook pages. A lot of people are on social media. This is where you can get good information out or you can get misinformation out. So we really encourage you to visit our main Facebook pages here in the county. We have the Haywood County NC Government Facebook page. We have the Haywood County Sheriff's Office Facebook page, the Haywood County North Carolina Health and Human Services page, as well as the Haywood County Emergency Services Facebook page. Also, if you would like to sign up for Haywood Alerts, that's another great resource we have. You just go to the county website, haywoodcountync.gov, and scroll down and click on the button that says County Alerts. When you sign up for this feature, you can receive news updates, you can receive traffic updates, emergency updates to your cell phone, to your email, phone call. It's a resource that we've had for a couple years now, and it's been fantastic having that. But the biggest message I want to share right now is if you have COVID-19 related questions, please call the Haywood County COVID-19 call line. That's 356-2019. They have 6 nurses manning this line, and they are there to tell you about local resources, COVID related questions. Again, we urge you to call this number and not our dispatch line, not Haywood County Sheriff's Office, not dispatch, not 911, of course, unless it's an emergency, because they are getting inundated with phone calls. Our Director of Communications told me a couple of times yesterday, we need to push this message out there. So if you can share that with the people you know, 356-2019 is the number to call. And a huge thank you to the people who are doing the call line. I went over there yesterday to share to go over some information, to ask what kind of calls they're receiving, and the calls started flooding in, and they're like, this is a call center, we're ready to go. So they're motivated, ready to help people with their questions. Thank you.
Good morning. Wayne Morgan, Liaison Officer. First of all, I'd like to thank all of the agencies, individuals, and businesses out there that are cooperating and assisting in this COVID-19 effort. As of Wednesday, the 25th, we had 95 different agencies and businesses assisting, cooperating, or helping with the efforts of Haywood County. You can find those agencies listed on the situation report from March the 25th. If you are not on that list, have not been contacted, or do not have a direct contact, please let me know. Again, Wayne Morgan, Liaison Officer at 828-507-2083. Thank you.
Good afternoon again, everyone. I'm Travis Donaldson. I'm your IMT team leader for COVID-19 in Haywood County. I would like to start out by thanking everyone involved in the response to this incident, to include all of our healthcare providers, our fire departments, our law enforcement agencies, volunteers, school systems, and all of our public and private partners, and most importantly, our citizens. The amount of collaboration and selflessness between individuals and groups to help us fight this battle is humbling, to say the least. Together, we will all get through this. Together, we will overcome. Now is the time to show the world how resilient Americans and North Carolinians really are. I would like to emphasize that everyone follow the plans and the organization structure that we have in place. These plans ensure that we have smooth and effective communication flow throughout the one team, one voice approach. If anyone out there has resources that we haven't already tapped or haven't already been brought to our attention, please email me at travis.donaldson@haywoodcountync.gov, or you can send a text message to 828-399-1054. I would like to end this with a quote from an unknown author. In the end, it'll be impossible to know if we overreacted or did too much, but it'll be quite apparent if we underreacted or did too little. May God bless everyone, stay safe, and again, together we will get through this.